The World Health Organization designated 2020 as the Year of the Nurse and Midwife to raise awareness of nurses and midwives' significant and varied roles in healthcare. Today, Molly talks with Dr. Robin Bagley, the Chief Nursing Officer for the American Hospital Association and the CEO of the American Organization for Nursing Leadership.
So hi, I'm Molly McCarthy with Microsoft. Microsoft and the American Hospital Association are partnering together to educate nurses and physicians on artificial intelligence in healthcare. Our mutual goal is to raise awareness and increase understanding of the scope of artificial intelligence, highlighting clinical and administrative use cases, as well as provide continuing education credits for both physicians, nurses, and hospital administrator. And I'm so excited to be here today with Dr. Robin Bagley, who is the Chief Nursing Officer for the American Hospital Association, as well as the CEO for AONL. Welcome, Robin.
Hi, Molly. It's great to be here.
Thank you so much for joining us today. It's really been a pleasure working with you and the American Hospital Association over the past year to put this course together. And would just love to hear from you. Tell me a little bit more about yourself and your journey to the AHA. I know we were talking earlier about the amount of time we've both been in healthcare. So I would love to hear a little bit more about your background.
Sure. Thank you, Molly. Well, I've been in healthcare a little bit longer than you have, but prior to my role here at the AHA and AONL, I began here almost 2 years ago in September. I was the Chief Nursing Officer for a healthcare system in southeastern New Jersey. Spent most of my professional career there, but the last 20 years, I was the Chief Nursing Officer. My clinical background is the maternal child field, which I began, after graduation a number of years ago, and spent some time in labor and delivery, the NICU, different aspects of OBGYN.
Great. That's another thing we have in common, because I started out in the neonatal intensive care unit, worked in peds and pediatric cardiology. So definitely a special place in my heart for the maternal child area. And thinking about the course that is getting ready to launch, wanted to hear from you, specifically based upon your experience as a chief nurse officer for many years within the healthcare industry, just the importance of providing clinical content around artificial intelligence and technology to our nurses and physicians, as well as healthcare administrators, and really talk a little bit more about the significance of this program.
Thanks, Molly. That's a great question. In my role as Chief Nursing Officer, I learned, firsthand what big decisions are made regarding the future, whether it's technology, whether it's AI. And I know that, many times I felt unprepared for the decisions that I needed to weigh in on. So I think, a course like this really provides the building blocks of and doesn't tell you necessarily it's not very prescriptive, but what it does is really gives you the information that you need to then make appropriate decisions. Not only just information, factual information, but also what processes to consider and who needs to be included. And I think in particular, what resonated with me was the whole issue of your culture. So every organization has a different culture, and how to set the decision-making process up for success, and decisions around implementation, et cetera. It was really, I think it was really a great coming together of both the technical side and the administrative and the clinical side. So I'm very proud, that we're going to be able to offer this program together.
Well, great. Really great points that you're making. And I think you mentioned kind of that trifecta of technical, clinical, and administrative. And I think that's so important when thinking about technology, not just the implementation piece, but really thinking about what's right for our organization and making those decisions, because not only do they impact the IT group, but certainly the clinicians and ultimately the patients. And just kind of a follow-up question to that, obviously the importance of the continuing education and having that credit available through this course, but really thinking about today's environment, the here, and now, and what's going on in the world. And just, can you talk a little bit about what you've seen in terms of the shift in technology from your perspective within the many hospitals that you work with across the U.S.?
Well, it's yes, I'm happy to address that. In speaking with nursing leaders across the country and clinical leaders, not just nurses, although that certainly is the group that I mainly interact with, we have heard from everyone that the crisis of the pandemic has spurred innovation, and one of those things that we see across the country is adoption of technology that maybe has been around for a little while, but there was a lot of, formerly there was reservation about using things. And this technology has been adopted and innovated so rapidly given the pandemic. And I think that, both patients have been much more accepting of technology. And I think our clinical caregivers understand that it can really help maximize not just their ability to care for more patients, but care for more patients safely. Right. And how can they really utilize this technology in new ways to take care of more patients and, extend their reach out into the community more rapidly. Right. And that's been a really great thing. I call that a silver lining of right. The pandemic. We have seen some really, we have seen some benefits, although of course, we're dealing with still in the middle of a lot of, really uncertain times.
Right. No. Yeah. And I think, from my standpoint, I've been at Microsoft for over 7 years and been talking about cloud technology and most certainly virtual health and virtual visits, et cetera, for a good 6 years. And just to see the adoption rate in the past 6 months has, trumped the past 6 years. So like you said, silver lining. Just a couple more questions here as we close out. One is, have you taken the course yourself? I know that I obviously been involved in the course and thinking about the expertise we needed to put it together, but and had the chance last month to look at it and take it, and just wanted to see if you've taken the course and kind of from your perspective, the outcomes that maybe you're looking for yourself and even nursing leadership.
Well, I did take it. I actually went online and reviewed the whole course, and I thought it was really very thought-provoking in addition to providing me with a lot of information, and it was very user-friendly. It's it was very enjoyable to do. And I know with our continuing education required, for our licensure, et cetera, some things aren't as, as pleasant and pleasurable. But I really felt like I learned a lot by completing the courses. And, you can take your time with it. It has different formats so that it's not all just one way of delivering the information. So I just thought it was really, it was really informative, and I hope that it's well accepted by our field. I think it will be, because it's really a pleasure to learn in this way.
Well, great. Thank you so much. Appreciate that candor. And just as we wrap up here, I know that you have a big meeting coming up in the end of September, and wanted to hear a little bit more about that and how people can get involved in that.
Sure. Thank you very much, Molly. Speaking of technology, of course, we had to cancel our annual meeting that was scheduled for March in person. So we are holding our virtual conference for AONL, the American Organization for Nursing Leadership, on September 24th. If you go to our website, AONL.com, you will be able to learn all you need to know if you'd like to register for our virtual conference. We have our keynote speakers who were to have presented in March that will be presenting in September, as well as many of our breakout groups. And again, it's a great opportunity for continuing education.
That's great. Well, thank you so much for taking time out of your busy schedule today. I certainly appreciate your expertise and look forward to continued partnership with you. So thank you.
My pleasure, Molly. Thank you.
Thank you all for watching. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.